Hello my dear doctors, welcome to rheumatology, that is a knowledge-based application. The topic, the Cryoglobulinaemia. Cryoglobulinaemia, once again, that I hope that you have already seen the video lectures, and there's this box, the screenshot is given here so that we can revise the one thing that we already learned from Cryoglobulinaemia lectures. So once again, revising the CGN, we put the Cryoglobulinaemia, the CGN, the type 1 and type 2 and 3. Type 1 is as simple as well as in contrast to the type 2 and 3 is a mixed variety. And type 1 is a mononuclear, is a monoclonal, yes, monoclonal. So here's the monoclonal is a multiple myeloma and well-installed macroglobulin in contrast to the mixed varieties in HCV. My dear, you must remember CGN, yes, once again the C virus means HCV, hepatitis C virus. Next, second box that we learned that Cryoglobulinaemia, ZN. Cryo, the word is really important. We need to remember the CR, cryo, this is really important. This leads to the hyperviscosity and also thrombotic features. So C for cryo, C for once again crocyanosis means the acrocyanosis due to thrombosis and leading to purpura, as well as the R for Raynaud's phenomena and also the retinal hemorrhage and libido reticularis. So once again, that at least the C and R that we need to remember for a crocyanosis and also Raynaud's phenomena. Third box is the MC. Yes, once again, the mixed Cryoglobulinaemia. We put the M for CGN. So once again, the MCGN means the MCGN. My dear, you will have the lectures in nephrology chapter that you will see that the MCGN having the type 1, type 2 and type 3 varieties of mesangiocapillary glomerulonephritis also. So the type 2 is strongly associated once again reverse, that is the hepatitis C virus. So we will learn once again MCGN, the rule of C means the hepatitis C virus. So what we have done here, there's this box that you learned from the video lecture that the mixed CGN equal to MCGN. So once again, that MCGN is also a mnemonics to help the remembering all the important parts. M starts with MCPs and PIPs means the metacarpophalangeal joints and also the proximal interphalangeal joints, knees and also these arthralgias and myalgias and malaise and fatigues. And C for one of the important features of complement levels will be low, means hypocomplementaemia, as well as the C3 and C4, especially C4 is low, and autoimmune hemolytic anemia. And next is the hepatitis C virus, C for hepatitis C and C for cutaneous vasculitis. But these vasculitis are ANCA negative, small vessel vasculitis. Next one, G for glomerulonephritis, and this is MCGN, and Z for galley is a hepatosplenomegaly. And for neuropathy, that is once again the peripheral neuropathy is sensory type. So the next point, the box, right, the CGN investigations. Once again, the CGN, C for C3, C4, C for cutaneous vasculitis with the skin biopsy, and GN for MCGN, that is the renal biopsy, and G for globulin level will be high, and N for anemia, there is a EIH. Next is the treatment of CGN. Once again, the rule of C, C for corticosteroid, the prednisolone, and C for cyclophosphamide, and with or without chlorambucil. The rule of C once again. And once again, the C for crocyanosis, and plus MCGN, once again CGN, severe, that needs basically the plasmapheresis. And hepatitis C virus, the underlying etiology, that should be treated by the PEG interferon and also the ribavirin. So that's all about the boxes that we learned from video lectures, my dear. So the next, right, now let's see that how KBA means the knowledge-based application and as well as the question-based approach, how this is helpful. According to the knowledge-based application and also the question-based approach, that always when you approach to the questions in your exam session, right, we will start the main question, my dear. What does the main question mean? Yes, this is the question. What is the best management for the patient's illness? This will give an idea, right, what things that we are dealing with, right? They say that the best management of the patient's illness. So we need to make our diagnosis first and then think about the best management. So starting with the PEG interferon and ribavirin, a good candidate immediately after that, they can think about, right, the PEG interferon and ribavirin is a treatment of hepatitis C virus. And having a treatment of corticosteroid, cyclophosphamide, and chlorambucil and plasmapheresis, all are the options that already you have seen from the boxes, that all of the options are treatment also for the, once again, that cryoglobulinemia. And once again, very close to cryoglobulinemia, the best etiological treatment is the PEG interferon and ribavirin. So now let's focus onto the scenarios, because this is said that the cryoglobulinemia is one of the important differentials here for the treatment options that are given for cryoglobulinemia. As I said, immediately after, the third step, the fourth step is the photography. So look into the photography is really helpful. So here is the first photograph. You see that the examination, she had a palpable purpura on the legs and arms, and there was no obvious evidence of joint swelling. So these are palpable purpura. So yes, cryoglobulinemia that already we learned, remember as this box, CR, once again, the Raynaud's phenomena, and Crow's haemolysis, thrombosis, as well as the purpura. So it's a typical vasculitic purpuras. Once again, the cryoglobulinemia is a likely diagnosis here. But other small vessel vasculitis can produce this category of the features in the skin. Next to the photography, the fifth step, focus onto the investigations data. One of the important tips that I'd like to add here, the data you see the starting from the hemoglobin ... and go up to the urine analysis. So sometimes I'm saying, right, the data, the last and bottom line data is the best data that will be helpful to reach your diagnosis. So that is the best approach, to go down to up rather than up to down. So let's talk about the urine analysis here. You see the blood and protein. So blood and protein, once again, means hematuria and proteinuria. We learn in the nephrology that we'll see this is the presentation of glomerular disease. So already we learned that from down that we have got an idea that CGN is a likely diagnosis, and they can be come with the MCGN. So they can have this proteinuria and also hematuria. Hepatitis HBsAg is negative, but anti-HCV antibody is strongly positive. So once again, the diagnosis is clean cut, that we are talking that CGN means the cryoglobulinemia, hepatitis C virus. And one of the C is very important. You see the C3 and C4, the complement levels, all right? So let's talk on them. So complement level is strongly associated. Low complement, the C3 and C4 is low than that of the normal range that is given within the brackets. Once again, that is, you see the rheumatoid factor IgM is positive. Yes, remember the mixed essential cryoglobulinaemia, having the antibody is positive. Alright, so mixed monoclonal and also polyclonal antibody is positive. So this is also important criteria of cryoglobulinemia. Next point, the albumin is 31, alkaline phosphatase is normal, but AST is slightly raised, but bilirubin is normal. Creatinine and urea is slightly increased. Creatinine and urea is slightly increased. So that is for the cryoglobulinemia leading to chronic kidney disease. Along with the potassium, sodium is normal, but the ESR is strongly raised. So once again, it's a cryoglobulinemia, is a vasculitis. That's why they're raised. And also the platelet is high, WBC count, and hemoglobin is low. So low hemoglobin, platelet high, raised ESR is an inflammatory markers. Urea creatinine, once again, is raised along with the urine analysis, blood and protein, hematuria and proteinuria, both are the chronic glomerulonephritis, the diseases. And the urea and creatinine, once again, is a chronic kidney disease is caused by the CGN, by the MCGN is likely possibilities. Here a little bit the AST is raised, as well as the albumin slightly low. So this is also leading to chronic liver disease features. That is also associated with the CGN, means hepatitis C virus, yes, leading to liver damage. So yes, my dear, immediately after the fifth step, that we will focus on to the examination parts. The sixth step, the examination part. The sheer palpable purpura is, once again, there is no various evidence of joint swelling. Abdominal examination revealed the hepatomegaly, palpable 4 cm below the costal margin. We already learned that hepatosplenomegaly can be a feature of Cryoglobulinemia. And neurologic examination revealed the loss of sensation in the hands and feet. Once again, the sensory loss, means the peripheral neuropathy, is an important feature of Cryoglobulinemia. Yes, CGN, N for neuropathy, and M for, once again, we learned that megaly as well. And that is really important. Now, let's focus on to the history. The 41-year-old woman, alright, was referred to the rheumatology OPD with the complaints of the malaise. Yes, having some of the malaise, also the CGN, joint pains and tingling in the hands and feet. Yes, so having malaise, having tingling in the hands and feet means the sensory polyneuropathy, as well as joint pain means the arthralgia. Yes. Once again, is a Cryoglobulinemia is likely. So she had been diagnosed having the Raynaud's phenomena for 3 years back. So yes, once again, the Cryoglobulinemia. The patient had to consult several doctors for intermittent malaise and joint pains, and there is no history of the night sweats, dyspnea, problems with the swallowing. Yes, the patient took paracetamol, PRN basis for joint pains. So problems with the swallowing. This is also important negative differentials, because having Raynaud's phenomena, we always talk the first diagnosis of Raynaud's phenomena is the SSC, means the systemic sclerosis. So he had no problem with the swallowing, so once again the negative for the SSC. So from the history is also more likely the CGN examination findings, there is the purpura as well as the sensations, CGN, and along with the important features that the C for C3 and C4 and C for C virus positivity, and MCGN variety of chronic kidney disease, and some of the hematuria, proteinuria, as well as the urea creatinine raised, and inflammatory markers are raised. So once again, the Cryoglobulinemia is a likely diagnosis. But among them, I'd like to talk on one of the important features of Cryoglobulinemia. The single talk, my dear, you must remember CGN, the C for hepatitis C virus, and second C that we must remember once again, that is the C3 and C4 is reduced. So focus on to the C3, C4 reduced and hepatitis C virus positive, and the likely diagnosis of Cryoglobulinemia. Once again, the treatment directs to the, of course, the PEG interferon and ribavirin is the best treatment to treat the patients. Underlying etiologies is the best treatment management for the Cryoglobulinemia, along with the CCC that already we learned, that C for corticosteroid, cyclophosphamide, chlorambucil, and chromocyanosis patient having the plasmapheresis as well as the MCGN, severe MCGN, and also the hepatitis C virus treatment. So now talk a little analytical talks on some of the explanations. It is said that these difficult questions. Yes. However, the clue lies in the fact that the patient has evidence of current or previous infection, hepatitis virus, Raynaud's phenomena, palpable purpura, neuropathy, hypocomplementaemia. Yes. The diagnosis consists of mixed essential Cryoglobulinaemia. Yes. Cryoglobulins are immunoglobulins that precipitate in the cold, so cryo-cold. Yes. Circle the way that I'm circling. Alright, that they are associated with the autoimmune hemolysis, Raynaud's disease. In severe cases, they can cause acronecrosis, vasculitis, peripheral neuropathy, glomerulonephritis, and hepatosplenomegaly. Complement is reduced. Hepatitis C virus is thought to play an etiological role in the development of type 2 and type 3 Cryoglobulinemia. Diagnosis based on the history, skin biopsy. hypocomplementaemia, presence of cryoglobulins. Investigation of cryoglobulins should always include the serology. That's very important. Cryoglobulin investigation should always include the hepatitis C virus infection. Treatment for acute cryoglobulinemia causing severe renal impairment or acronecrosis. Yes, the plasmapheresis, though in less acute situations that the prednisolone and cyclophosphamide are effective. Chlorambucil has also been used with success. When cryoglobulin is secondary to HCV infection, the treatment of choice includes a combination of peg interferon and ribavirin. So yes, cryoglobulin is secondary to HCV. Always the treatment of choice is once again the peg interferon and ribavirin. Ribavirin, once again, that you need to remember, are for ribavirin and R for renal failure. This is an important box that you can make here. That will be helpful. Now let's talk some of the points here, right? The type 1, type 2, type 3 that already we classified and we learned. Next point, right, is same thing, the type 1, type 2 and type 3. And these are rash that lower extremity types of cutaneous small vessel vasculitis due to cryoglobulin secondary to hepatitis C virus infections, and some of the cryoglobulin rash. And this is very important, right? The biopsy findings. This is the biopsy of renal biopsy that showed that cryoglobulinemic glomerulonephritis. Very important photography that you need to know, my dear. So the glomerulus shows the global occlusion of the peripheral capillary lumina by numerous infiltrating monocytes. Segmental intracapillary pink staining, immune thrombi, likely representing the cryoglobulin deposits, are seen. So my dear, you look into the pink shape, pink staining, immune thrombi. So these are basically the cryoglobulins. Sometimes in your scenarios, the photographs of the renal biopsy are also given. So you must identify this pink staining thrombi is nothing but the cryoglobulin deposits. So these are cryoglobulinemia. Once again, there is a widespread duplication of the glomerular-basement membrane with the cellular interposition. But we learned that cryoglobulinemia can present with the MCGN, means the mesangiocapillary globulinephritis. And once again, that the type 2 basically is strongly associated with the cryoglobulinephritis. And one of the important points that you see the pink staining, even thrombi. Next, another photography is also, you see that the different cryoglobulins deposits here, right? So increased cells and cryoglobulin deposits in glomerulus by light microscopy, and cryoglobulin deposition in the glomerulus by immunofluorescence microscopy. These are cryoglobulins. Cryoglobulin deposition in the small artery vasculitis also, yes. And this is the normal glomerulus for comparison. So this is normal and this is the cryoglobulins, yes, so that we can differentiate. So here is also is given, all right. So these are the cryoglobulins, all right. This is also the cryoglobulins, the arrows. Figure shows another case of the hepatitis C, the MPGN. Yes, another name of the MCGN, mind you, that's very important. Membranoproliferative glomerulonephritis. That will be learned in the chapter of nephrology, which differs from the case illustrated in figure 1 by the presence of intracapillary plaques or eosinophilic material that are accumulations of cryoglobulin. And figure 3b shows the same glomerulus stained with pus, which highlights the plaques of cryoglobulins. Yes. So these are cryoglobulins and these are cryoglobulins. Yes. The word of MCGN is really important because the name of MCGN is the MPGN, membranoproliferative. So that's important, glomerular basement membrane. Yes. Membranoproliferative is a duplication. Yes. As with the cellular interposition. So membrane will be the duplicate, alright. Membranoproliferative and also the cryoglobulin depositions. Here is another figure, right, that is given, right. The dermal renal vasculitis in a chronic hepatitis patient presenting as a recurrent purpura of the lower legs with the cryoglobulinemia, hypocomplementaemia and hematuria, proteinuria, palpable part of the lower legs. And the B photography showed that the histopathology palpable purpura, that is leucoclastic vasculitis of the dermal vessels. So these are the leucoclastic vasculitis. Next, the infectious mixed Cryoglobulinaemia caused by hepatitis C virus and non-hepatitis C virus also possible. And these are non-severe manifestations that antiviral treatment and severe manifestations. There is written that immunosuppressive therapy, preferably rituximab, followed by initiation of antiviral therapy. So this is very important, that the patients having the Cryoglobulinaemia, the treatment protocol is very important, right? So non-severe, once again, go for antiviral treatment. And if it's severe, then start with the immunosuppressive therapy, preferably rituximab, followed by initial antiviral therapy. In patients with rapidly evolving life-threatening disease, use intensive immunosuppressive agents, pulse, corticosteroid, plasma exchange, rituximab, or other form of immunosuppressive therapy. And non-HCV treatment of underlying infection, if effective anti-infective agent is available, use of IST alone is not recommended, can result in infection flare and resistant Cryoglobulinaemia. Means other than the HCV infections, that treat the infections fast, followed by immunosuppressive treatments. So in refractory disease and anti-infective agents, addition of IST is recommended. HCV cryoglobulinemic vasculitis. Therapeutic strategies: mild, moderate, and severe catastrophic. So mild to moderate, right, optimized antivirals. Severe renal disease, mononeuropathy, multiplex, and skin necrosis, especially the severe renal and skin necrosis. Yes, the rituximab and then optimized antivirals. And catastrophic, they are like the rapidly progressive glomerulonephritis and CNS, pulmonary involvement, rituximab and plasma exchange, along with optimized antivirals. So optimized antivirals is the main treatment in HCV Cryoglobulinaemia, along with the immunosuppressive treatments. There are some suspected systemic vasculitis syndrome, and the different features are given, right? So you can go through them, because each and every diseases will be discussed separately. So on the box is given this really important idea. Yes, the SS box HCV, there is a Cryoglobulinaemia treatment. Once again, C for anti-HCV, the PEG interferon ribavirin is the first step. And Z for glomerulonephritis, means the MCGN, is the rituximab, is the second step. And once again, N for neuronephro, RPGN, and here's the pulmonary involvement. Once again, plasma exchange is the third step. So the two important words that you need to remember, once again, the ribavirin, rituximab, and plasma exchange. Ribavirin, rituximab, plasma exchange. Ribavirin, rituximab, plasma exchange. Say with me, my dear. That will be helpful. Yes. And non-infectious mixed Cryoglobulinaemia, you can just look into what are the options, but this is not really needed for your exams, my dear. Yes. Here are some of the keys of word that is given from the boxes, that yes, this is given. Some of the vasculitic syndromes are here, so that will be helpful for just go through 1 or 2 times only. Next, now the correct answer. What is the best management of the patient's illness? Yes, the PEG interferon, ribavirin, is the best treatment for this patient's illness first, and then if needed, that you can go for immunosuppressive treatment. So the box of immunosuppressive treatment in the first line, the ribavirin, second line rituximab, and third line, yes, once again, the plasma exchange. The treatment and indications are given here. And here are some of the references, the photographies, and also some of the things that taken, so you can get them for the detailed study. All right. But what is the recommendations? That stick to this here, the KV5, that's more than enough to prepare yourself. Best preparations for you, my dear, for the MRCP exam. So, my dear, listen very carefully. So, the summary talk of the Cryoglobulinaemia, that what we learned. We learned that, once again, the boxes that we learned from here. So, I hope that you enjoyed, my dear. Thank you very much once again. Thank you. If you like our videos, don't forget to subscribe our channel and click on bell button to get more updates.